Thank you for the introduction. It's an honor for me to talk about lymphedema. Among lymphedema, I would like to talk about prevention and rehabilitation. Let me briefly introduce lymphedema. Lymphedema is swelling in the body due to reduced lymphatic transfer by lymph damage or functional disorders. There are multiple lymph nodes, and under the arm, this lymph node is related to breast cancer. Liquid fluid has a singular direction circulation, and when there are dysfunctions somewhere, there is a swelling occurring, and that's lymphedema. And this is lymphoscintigraphy result. And this is where the lesion is, and you can see that the flow is stuck there, and this causes a lymphedema. And according to the society, there are different ways of measuring. For example, if there are 2 centimeter or higher difference in the arm circumference, and if the mass between two sides is higher than 200 milliliter, then it is lymphedema. And the swelling, which can be picked up by other people, then it is also included as a lymphedema. So according to this definition, the simple swelling, you may think, is the definition of lymphedema. However, there are different stages, and depending on each stage, there are accompanying changes. The stage 1 is when the swelling is found around the body, and pitting edema is shown in physical exam. But when it gets elevated and right after you wake up, the symptoms are better. Stage 2 is when fibrous in organ processes, and when it becomes sponge-like. And in this stage, there's no pitting edema. And the stage 3 is about fibrosis, when it is reached to the stiff stage. And from stage 2, natural recovery is not possible, and our patients are mostly visiting hospital in stage 2, because in stage 1 the swelling gets better in the morning. But we ask our patients to come visit a hospital from stage 1 as it aggravates. From just looking at it, you see there is a simple increase in volume. But with ultrasound, subcutaneous tissues are changing. And according to the surgeon report, the lymph tube was normal, but with progression, it gets swollen and contracted, and it gets stiffened. So the change of lymph tube must be identified to make sure that we could prevent it from aggravation. In order for early detection, because we do not see the patient every day, for our patient, we ask them to check about this swelling. With this lymphedema, you do not see a consistent swelling from finger to the arm. It occurs in each region. So please compare your 2 hands and also 2 feet, And as for self symptoms, after using your hand, you feel happiness, but after taking a rest, you feel better. But if you use your hand again, the cycle repeats. And these symptoms can be explanation for potential lymphedema. And in many cases, patients do not really know, and there could be inflammation because of virus infection. And with flashes, you may go see your doctor, and that is already late. It's important to have early diagnosis. So if you have any suspicion, please talk to your rehabilitation doctor or your doctor for breast cancer treatment. So how long should I be considerate about lymphedema? After surgery and after treatment, up to 2 years, the occurrence of lymphedema increases. But usually within 3 years, 91%. So for 3 years, please pay attention. Regarding inflammation, lymphedema could happen after the inflammation. So please be careful in maintaining your lifestyle. Next, prevention of lymphedema. How can we make sure that lymphedema is prevented 100%? There is no magic bullet, but there are theoretical explanations. Let's say this is a normal transport capacity of lymphatic load. This is normal load, and the difference here is with certain issues, this is the buffer that we have as a spare with surgery or radiation, and with other treatment with reduction in functional aspect, the transport capacity, the load is reduced. And if this can be handled, then the lymphedema is prevented. But when lymphatic load increases under normal circumstances, it's okay. But with a decreased capacity, you cannot handle this additional load, and that is the cause of the lymphedema. Causes of Bcrv. First, the treatment. Compared to sentinel node surgery, lymph node resection of armpit has higher probability. And lymph node resection of armpit, and there is metastasis to lymph node, there is higher probability of lymphedema. These cannot be controlled by us. So there are other risk factors that we need to be mindful. First, overweight. Second, and infection. These two has elevated lymphedema occurrence. And when there is an overload in the transport capacity, there is an increased risk. So we provide information about daily lives. It talks about the factors increasing the generation of lymphatic fluid and the factors prohibiting the flow. This is the leaflet from National Cancer Information Center. And warm heat, infection, and too much weight training will increase the generation of lymphatic fluid. And tight underwear would prohibit the flow of the lymphatic fluid. But you don't need to be oversensitive on these factors. What matters is that if these did not lead to the infection, you don't need to worry too much about it. And these are theoretical information. So a single case or event of this exposure does not necessarily lead to increased risk of lymphedema. Overweight and cellulitis are two strongest factors. If there is a deep scar and if it leads to cellulitis, then the risk increases. So make sure there are no deep scars. And weight training. If you do too much, then it has a negative impact. Muscle contraction will help the flow of lymphatic fluid. So if you try not to use any muscles in your routine life, then it's not good. So you have to make sure that an appropriate level of muscle contraction is required. So this muscle pump helps the absorption of protein and the flow of lymphatic fluid. Too much weight training will lead to the generation of interstitial fluid, which will have a negative impact. So in the recommendation, it says consult exercise specialist to work on the exercise plan. And to avoid overuse of muscles, you must start at a low-level weight training. Low-level weight training includes stretching, and for weight training, starting with 500 gram of weight. And it is important to find your own exercise threshold. For some patients, they start from 500 gram and then they could increase the weight. But some patients find it difficult to lift up 500 gram. So finding your own exercise threshold is important. The suitable level of exercise will help you. So if you do not feel comfortable and if 30-minute exercise is too much, please check all these aspects to come up with customized and most optimal exercise plan. So please talk to your trainer and doctor. And for my outpatients, sometimes they work out too much and they have lymphedema. And these are two most frequent exercises overdone. Yoga and including yoga, there are different types of exercises. But bearing the total weight with your arms only is not good. And for your upper body exercise, there are 10 kilogram and 20 kilogram weight. And after a heavy weight, sometimes you feel swelling, and that is too much, too heavy. So before you start weight training, please check with the appropriate level of weight, starting from relatively light weight. Next, rehabilitation therapy of lymphedema. We have complex decongestive physical therapy, including these 4 factors. First is manual lymphatic drainage, and then skin care, therapeutic exercise, and compression therapy. With right mixture of this, we provide exercise education. The goal of lymphedema treatment is to ease the symptoms and to ease fibrosis and prevent inflammation, and then improvement in the quality of life and recovery of functions. lymph scintigraphy image of two different patients. I included these images because the one you saw previously, this is where the lesion is. There is a lymph node in armpit, and the flow is stuck. But the second image does not show the armpit lymph node. When we diagnose lymphedema, there are series of screening. The reason why we do screening is to see the functionality and fluid of the remaining lymph node. We want to come up with the right mixture of the treatment and exercise. Patients are interested in what other patients are doing. So they have a lot of questions. Why am I not doing this, and why am I doing this? So we try to emphasize what is most needed for each and every patient. So more details for each treatment. Complex decongestive physical therapy, starting from the periphery to the center. That is the direction of the fluid. So we use our hands to help the flow of the lymphatic fluid. Using the abrasion power of the hand, we do massage to make sure that the fluid does not get stuck. Skin care is to make sure that the skin is not too dry because of the risk of the infection. Next, therapeutic exercise. Appropriate muscle movement helps the circulation of the fluid. So clenching fist and arm movement can help. Through abdominal breathing, you could also facilitate the fluid circulation. So we provide training about how to do abdominal breathing. Next, compression therapy using compression stockings and bandage. This compressive stocking is not very elastic, so you may feel uncomfortable. When you stay still, the pressure is not high. When you move, when there is a muscle constriction, there is a pressure from outside to the fluid so that the circulation can be done smoothly. And this is recently included in the national medical insurance. And Circ-8 and AutoFit are new stockings, so it's much easier for patients to wear them overnight. So there are increasing interest of these stockings. That's why I included this picture. Some patients see benefits, and some patients do not really need these stockings. So it depends on each patient. Next, resistant exercise. When there is a lymphedema, is it good to have resistance exercise or not? It has been controversial even among specialists. It is very important. The resistant exercise in upper extremity does not worsen the lymphedema, and it helps upper and lower muscle strength. Then how to do it? With the supervision of special expert, you have to gradually increase the strength, starting from the low strength. As for the weight and the time, starting from, for example, 10 minutes and extending to 20 to 30 minutes. And during exercise, if the lymphedema gets worsened, please stop exercise and see doctors. The worsening of lymphedema, if you do not have the lymphedema, then you see the difference immediately. But if you have been having a lymphedema for 2 to 3 years, it's difficult for you to see the differences. So if you have been suffering from lymphedema for 2 to 3 years already, please pay more attention. This is summary. Early diagnosis is important because it is better to start treating this lymphedema from the early stage. If you feel heaviness and if you see lymphedema, please talk to your doctor. And there are lifestyle advices. We have to make sure that there is no inflammation. And lymphedema, as I mentioned before, there is rehabilitation treatment, but this is a chronic disease, so you have to receive training and education so that you could self-manage these symptoms. And it is important to understand the most optimal treatment options for you. And for exercise, start from low strength and short period and try to extend the weight and time gradually. And when you feel pain and when there is a fever, then talk to the doctors. Thank you for